I am a teacher at Carter Elementary. I teach second grade. I was 40 when my stroke happened.
It was about 6:30 actually, and it sounded like a huge crash inside of the bed. And got up and checked on her and found she was laying next to the bed and just not acting right. I was able to tell really quickly she was having a stroke because she wasn't able to move her right arm or right leg. She wasn't able to speak at all, and when she went to kind of smile and look at me, she was only moving one side of her face.
A stroke is when the blood supply to the brain is cut off. It typically involves a small area of the brain, and it can occur for many different reasons. The most common is a clot gets stuck up there or forms in the brain itself. When the brain loses that blood supply, the part of the body that part of the brain controls stops functioning. That's what gives you the symptoms of a stroke. Ms. Blackstock actually had right-sided weakness, and her husband, being a medical professional, recognized the signs and symptoms as soon as he saw them.
I just know the fire department was there about 5 minutes after we called. Ambulance arrived just a few minutes after that, and they were very quick. We all knew what was going on. We all knew where she needed to come. There was no question that we were going to come to Fort Sanders because in East Tennessee, that's where we go if you're having a stroke.
As a comprehensive stroke center, we have a team dedicated here 24 hours a day, 7 days a week to provide care to patients that's not available in other facilities.
So we have several methods of removing clots from the brain. One is to use a small catheter that we thread up from the groin that's like a small vacuum cleaner that sucks the clot out. The second is a small stent device that grabs the clot and allows us to pull the clot out from the brain, restoring blood flow and function to that side of the brain. Mrs. Blackstock was enrolled in a trial that lets us look at 2 different devices to see which one performs better. This will help not only her, but also patients in the future as we become better and better at treating strokes going forward. In Ms. Blackstock's case, after pulling the clot out, she began to move her right side immediately and recovered most of her function during the procedure. The one thing that everyone must know about stroke is if you think you're having a stroke, act quickly. The sooner you get to the hospital, the more likely you are to go home, as Ms. Blackstock did, and return to a normal lifestyle.
Time is brain is kind of how we put it. And so what that means is the longer it takes for you to get to the hospital, the more brain may die. And so getting here, getting to the treatment that you need, getting that clot out, that can mean the difference between walking out of the hospital the next day or living with permanent problems.
It's not uncommon that when we're able to go up and pull that clot out, the patients can have a remarkable recovery on the table.
Our ability to quickly and effectively treat patients who are brought to us via EMS involves us having an established relationship with EMS providers. So our stroke team at Fort Sanders Regional actively participates in education of EMS providers. So working together with them collaboratively helps benefit the patient to get the best care, not only once they arrive at the hospital, but before they get to us as well.
I would recommend Fort Sanders because they are the best. If I went somewhere else, I wouldn't have had Dr. Woodward, and he wouldn't have been able to pull 95% of the clot out. I'm 3 months out from my stroke, and I feel like I'm getting it all back together and that I will be back in the classroom. I do go see my kids whenever I can. Twice a week, I see Mary Margaret, and she's outstanding. She really pushes me hard, but she's really good. I'm truly blessed that I was here and that Justin was there for me. Coming here to Fort Sanders is the reason why I'm here today.